What is emotional intelligence in regard to CRNA school? This is a hot topic, stuff that people talk about a lot. When you're interviewing for CRNA programs, they want to evaluate your emotional intelligence. And when you are a CRNA, you have to possess emotional intelligence in the operating room, etc. So let's get into what that means. So emotional intelligence is basically being able to manage your own emotions and understand the emotions of people around you. So reading the room is a good example, or, having maturity, having self-control, etc. So one of the things with being in CRNA school is that you are dealing with a lot of different personalities in the clinical environment. So you are, like I've mentioned before, you're with a different preceptor every day. So you are following the lead of the CRNA that is training you. You are also following the lead of what's going on in the room. You're dealing with surgeons, you're dealing with circulators, scrubs, etc. There's a lot of people that are coming together for the common goal, which is the patient. Being able to handle stressful situations and scenarios, right? So most cases in the OR go smoothly. Most patients do fine. That's not always the case all the time. Things do go wrong. How are you handling that? Are you calm, cool, and collected, moving with urgency, handling the situation as appropriately so? How are you communicating with people? To be a good SRNA and a good CRNA, I feel like you really need to have good communication skills. So maturity, right? Being able to read the room, right? Being able to assess when things are changing, being able to assess people's emotions, right? Assessing what is going on. Being an advocate for your patient in whatever capacity that may entail for the moment. And, CRNA programs may want to assess, how you deal with complex situations, or, if somebody offends you, how do you respond? If somebody starts yelling at you, how are you going to react? Are you going to yell back? Are you going to, get upset and emotional? Are you going to, stand your ground? What are you going to do in those scenarios? How are you going to handle tense conversations? How are you going to handle being told that you're not doing something correct? That's a big one. Big thing in CRNA school is, as an SRNA, being told that you're doing something wrong, and that is the name of that's going to happen. It's happened to me, it's happened to every SRNA. How you handle that, how you handle constructive criticism and feedback, or how you handle just plain criticism. Not letting it bother you, not letting it eat you up inside to the point where you're unable to function, and not letting it bother you to the point where you lash out and lash back. These are all things that make you successful in the OR. So keep those in mind.